While there are fears that taxi ranks in Limpopo may become COVID-19 super spreaders following the deaths and infections of several taxi drivers and owners in the Polokwane area. This comes as the number of new infections in the province rapidly increase. Limpopo officials have also confirmed that private hospitals in the area have reached capacity. Joining us to discuss this further is the Premier of Limpopo, Stan Mathabata. Good evening, Premier. Thanks for your time then tonight. Limpopo seems to be well in the grip of its second wave. My understanding is that when it comes to this current rate of infection, it's been much higher than what you may have initially anticipated.
Precisely. We have had a very huge spike in this second wave as compared to the first wave. Hence, you are seeing this response that we are coming up with.
What do you think is driving this high rate of infection?
We have identified that most of, in fact, the bulk of our statistics is at the age of 30 to 39. Then that automatically tells you that there is a connection between this and the lifestyle of young people, which is parties, football tournaments. We had a lot of them, amateur football tournaments in this province. We had a lot of them also. And funerals also. And after, what do they call them? The after tears parties that people are holding after funerals. I think we realize, we have identified those as the major spreaders of the super spreaders of this virus. Hence, we said we need to target the young ones. We need to target the taxi ranks and the public transport under general, because we're given even the information that in most taxis, you find that people just put on their masks for compliance purposes. You know, when they see compliance officers. If there is no traffic cop, if there is no policeman that is stopping them, people are not wearing their masks. So we have targeted them. We have targeted these parties. We have then said, on and above this, we need to come up with an aggressive form of communicating information to our people. Make it a point that each and every corner of our province, there is somebody who's spreading this message, that there are these protocols, there are these regulations. If you don't follow these regulations, the resultant of that is that people will die.
Do you think that there's been a bit of a lax in terms of the communication strategies with communities, especially because in the first wave of the COVID-19 in the country, the number and the rate of infection of Limpopo was relatively low?
It was relatively low, but remember, most of the people who are resident in the province are not currently, we wouldn't say are the people who have been super spreaders. I think people who are, this interprovincial travel is something that caused a lot of problem for us. And the issue of the transit, Polokwane being the transit to Zimbabwe and everywhere else. I think that is what sparked most of our problems that we're encountering now. Hence, you're seeing now that people are going back to work. The numbers are now reducing in the province.
With the private...
So,
sure.
Yes, I'm listening.
Sure. With private healthcare facilities already coming under strain as a result of admissions, what is the situation like in the public hospitals right now?
No, the public hospital is still having a lot of space in public hospitals. We don't have any reason to panic in public hospitals now. We still have a lot of space because even people because we are working very closely with the private hospitals. Even the private hospitals are actually transferring some of their people to our public facilities. When it comes to public facilities, we're still having space, but we are saying if the numbers, if the figures can increase, more than 10% of the population of our province, then we'll start having problems, very serious problems.
Of course, in the last couple of weeks, one of the things we've also seen is the huge numbers of people trying to cross the Beitbridge border into South Africa, and they would primarily be going through the Limpopo province, Premier. What kind of impact has that had on the infection rate? And have you been able to tally the situation in terms of what's really happening in Musina and the spread of COVID-19 there?
Hence, when I was responding to your earlier question, Kathy, I made reference to that you get Polokwane, for example, being sort of a transit town. Polokwane, Makhado, and Musina being transit towns for these people. Hence, you see, our biggest problem now is in Capricorn, and in Polokwane in particular is the hotspot that we are currently having in Capricorn district. And then you'll go to the areas of Bembe, then you'll find Makhado as one of the area for concern. And then Waterberg, you'll get Lephalale as one of the area for concern. That's where you get a lot of economic activity. So these people, when they come, some of them are economic tourists. They go there for whatever trading purposes that they are engaged in. So that definitely cannot be ruled out as one of the causes.
Premier, one of the things that we've seen today is out in the Western Cape, the Premier there, Alan Winde, saying that he's going to try and independently procure COVID-19 vaccines for his province. Is that something that you would consider?
Well, we are one country, and to me, we are a unitary country. We need to approach this virus together. If we are not united in our approach to whatever mechanisms that we are coming up with to fight this virus, then we will seriously encounter a very serious problem. But for the approach and all the efforts that we are jointly putting into place with the national government, I'm satisfied that we'll be in the position to cover everybody as soon as possible in this province.
As a province,
I don't think there is any need for any other form of panic that we should go it alone and all this kind of thing. We'll do it together as a country.
As a province, do you still feel that you have the situation under control?
Yes, absolutely. Absolutely. As a province, I feel we do. We don't have a situation where we can throw our hands up or start kicking whatever. I'm sure that all the measures that we put in place, are still sufficient to can deal with the kind of surge that we are having now. We haven't reached a situation where we can say we need now to mobilize support from somewhere else. The resources, the little resources that we are having now are still able to cover a lot of the problems that we're encountering currently.
All right, that was Limpopo Premier Stan Mathabatha.